Hi, Dr. Pooja. Welcome to EPOMEC 11. How's your experience this year?
It's quite a good experience. To be very honest, this is my first EPOMEC. I've always heard a lot about this meeting and have always been wanting to come. And luckily this year, Dr. Murad and Dr. Salala invited us, and I'm fortunate to be here. And it's a completely different experience. I would say I come from India, where meetings happen in different way. We have tens of thousands of people, we have like tons of halls and everything. So I've seen that part of the world, but what I like about the meeting is how well it is organized, and how the best part is there are 3 sessions running in the same hall. You have your headphones, you can switch the channel between any of the three topics or the sessions which are happening. Basically you get the essence or advantage to attend all the 3 sessions, which is very good. Otherwise, most of the times, if I'm interested in listening to one talk from one session, the second talk from third session, I just keep running. I can't. I don't give my time to a good quality time to either of the sessions. So this lets me do that. So I just love this concept.
So it's time management, very efficient.
Brilliantly done. Brilliantly done.
Yes, interesting. So you mentioned that you are going to be speaking, giving a speech here also. What is the topic about?
So there are a few topics I'm going to be talking about. One is on dry eye. We are in an era where the MGD or dry eye, let's say, it's quite prevalent, and it's becoming more and more because of the computer use or digital screens. So I'm going to be talking about what would be my 5 secrets about management of a dry eye disease, and choosing those 5 secrets and giving the delegates the essence of it is quite good. And the second thing, I'm a refractive surgeon. So I'm going to be talking about what are the red flags in refractive surgery where you shouldn't do one. Then again, because having a lot of experience in lenticle extraction procedures, I'm going to be giving 2 talks on silk technology on Elite from J&J.
J&J,
So
interesting.
quite busy, and we do a lot of research and innovation. So there was a session on Shark Tank. So I'm going to be presenting one innovation in the Shark Tank session also.
Interesting. I'm curious to know more about these 5 tips for dry eye. Could you tell us these 5 tips shortly?
Uh, I'll be like, the 5 secrets for a clinician would be starting from history taking, diagnosis to management. But if I want to educate the normal population, which are not only doctors, then I would say that, blink properly and make sure that you're blinking adequately, not a partial blink, because when you use computers, you avoid blinking. You just subconsciously stop blinking, and when you don't blink, your tear film starts getting affected. So that's what is one of the major reasons which leads to dry eye. So blink properly. And the second thing I would say is a rule of 20-20-20. Every 20 minutes, look at a distance of 20 meters for at least 20 seconds, because that breaks the monotony of looking at one distance. I would love to tell everyone to have more breaks from computers, but this is the least they can do. And the other few things what they can do is, if they feel they have dryness and in spite of doing some modification in lifestyle, it's not helping, then they should visit a doctor to see what's happening. And one more thing what they can do is, apart from a lifestyle modification, they can take care of their diet.
Yes.
Diet is the most important factor, and a healthy antioxidant-rich diet is something which goes a long way again. So this will be the few secrets. And vitamin D, of
Yes.
course. Vitamin D is also very important, because sometimes we are you are in Dubai, I'm in India. We are in a sunny country, but we are always in this closed room, chamber.
Yes.
So we don't get enough natural vitamin D. So we should get our vitamin D's tested regularly and start taking supplements if needed. So if you take care of this, trust me, 60 to 70% of the dry eye is treated, which is related
Interesting.
to.
Actually, the reason why I asked this question is because I have dry eye, and it's very obvious on the left eye,
lights?
the lights also. So as you were telling me these advice, I was taking care of my blinking. So thank you.
It helps a lot. Like
Yeah.
recently, sometimes you go back to the basics. You have the best of medications, you
Yeah.
have the best of diagnostics, you have the best of therapies. But sometimes if you don't take care of the basic things, it doesn't
Nothing
help.
will happen. Yeah. Thank you very much,
Thank
Dr.
you. Take
Pooja.
care.
Appreciate
Thank
it.
you.
Thank you.